Hello, my good people. It's my wish the week is going on well, and we are back to our educational forum, whereby we keep you updated with educational bangers. And we promised to deliver, and we are doing exactly that. Before I start the topic of today, let me start by thanking you guys for the support you are showing me, for the subscriptions, for the sharing, for the comments, and the likes. And for those who are requesting their topics to be discussed, I beg that you be patient with us, because I have so many topics I've been given by my clients to discuss. So just be patient, and your topic will be discussed in a few days. So today we are finishing our topic, which has been so broad, so wide, whereby we have been discussing about fibroids. And in this video, we are going to talk about subserosal fibroids, in particular, complications in pregnancy. So, there is a small risk that fibroids may cause complications in pregnancy, and depending on factors such as size of the fibroids. So what I mean here, in pregnancy, fibroids can cause complications, and these majorly depend on the size of the fibroid. For example, when the size is so small, we always advise the mother to go get pregnant, and during delivery she signs for a cesarean section and myomectomy or hysterectomy, or removal of the uterus or of the fibroid together with the baby. So there is a small risk that fibroids may cause complications in pregnancy, and it always depends on the size of the fibroid. Such complications which may occur as a result of a fibroid include the following. One, we have what you call cesarean section delivery. As I explained just a few minutes ago, we might advise, or the healthcare provider can advise a lady to go get pregnant if the fibroid is a bit small. Then during delivery, or when the pregnancy is term, instead of going for a normal delivery, she goes for a cesarean section, whereby the baby is removed together with the fibroid. Another one, or another complication which may occur as a result of a fibroid, and depending on the size, is what we call breech presentation. Breech presentation. This is whereby the baby enters the birth canal, where the baby enters the birth canal upside down, or the legs or the buttocks may be leading. We are always used to a normal delivery, which we call vertex delivery, whereby the head is the one that leads the way out. But in this kind of a presentation or breech presentation, the baby presents by the legs or the buttocks. This may be caused by the size of the fibroid. If the fibroid is so large, it makes it impossible for the baby to rotate inside the uterus, and this may lead to the breech presentation. Number 3, we have what we call preterm births or miscarriage. Preterm means the baby may be born before 9 months or before the exact time of delivery. And also miscarriage. This is whereby a lady loses her pregnancy due to the pressure inside the uterus by the fibroid. We have also what we call, or number 4, we have placenta previa. Placenta previa simply means placenta may be covering the cervix. Number 5, we have what we call postpartum. postpartum hemorrhage or bleeding immediately after delivery, which may be excess. So postpartum hemorrhage means excessive bleeding after giving birth. So how can a woman, how can a lady cope with the fibroids? Note this, fibroids cause no symptoms at all and require no treatment or management unless they become problematic or they start causing serious complications. Another point to note, if you have symptomatic fibroids, contact your healthcare provider about treatment plans, as symptoms management may not be enough. So if your fibroid becomes problematic, maybe it starts giving you a lot of discomfort and pain, contact your healthcare provider, whereby he or she will sit down and discuss with you about the best management, as the management of the symptoms alone may not be enough. So what should you do? What actions should you do to help you cope with the fibroid which are waiting for treatment? If you are having fibroids and you are waiting, you have planned for your treatment, what should you do to cope with this kind of a situation? Number one, take measures to relieve constipation during bowel movement. Take measures to relieve constipation or bloating or straining during bowel movement. For example, drinking a lot of water, eating fruits like pawpaws, eating diet with high fiber diet. Number two, place a hot water bottle or eating pad on your lower abdomen. Place a hot water bottle or a eating pad on your lower abdomen. This helps in relieving the symptoms or relieving the pain. Remember, you are waiting. You have planned for a best treatment for your fibroid, and you have to cope with these kind of discomforts. Number three, eat foods which are high in beta carotene. For example, sweet potatoes, spinach, carrots. Number four, eat foods rich in iron. For example, whole grains, spinach, shellfish, beans and lentils. For example, pumpkin seeds, cashews and dark chocolate. Eat foods rich in iron. For example, whole grains, spinach, shellfish, beans and lentils, pumpkin seeds, cashews and dark chocolate. Number five, eat high fiber whole grains. As you know, high fiber diet will assist in digestion, and this reduces the constipation. So the next point is exercise. Don't push yourself in it if you feel pain and discomfort. You should do exercises. Exercises always assist in digestion. For example, for those who do exercise to reduce their tummy, while you are on your exercise, your digestion will always be excellent. So although the exercises are very important, don't push yourself if you are having pain and discomfort. Number seven, take over-the-counter drugs for pain relief. For example, Brufen. Number eight, check and manage blood pressure if necessary, because there is a correlation between blood pressure and fibroid. Check your blood pressure. Check and manage your blood pressure if necessary, because there is a correlation between blood pressure and fibroids. Number 9, manage stress levels through relaxation techniques, for example, doing yoga and massage. Number 10, avoid inflammatory foods. Avoid inflammatory foods, alcohol, and food that cause cramping and increased rate of urination. Avoid inflammatory foods, alcohol, and food that cause cramping and increased urination rate. This marks the end of our first video today. Let's meet in the next video. Guys, continue keeping the support on. Thank you for the far you have taken me. We are almost at 8,000 subscribers. It has been a long journey, but with your support, I can see success. So let's continue supporting. Let's continue subscribing, sharing, and commenting on our videos. Let's meet in the next video.